Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
The thing that's really helped me prepare for this role is, being a part of something that's new, where like a lot of the roles that I've been in, whether that was, being the director of the peer services program at ASH when I was hired on and then moved into a leadership position, I was a lot of times the first person to sit on different committees or to do different things, being a part of the legislative push or a part of the Hogg Policy Academy was, kind of the first peer support program that was really involved with that initiative that you all do at the Hogg Foundation, with policy fellows. Or when I switched over and was, working at Bluebonnet Trails, like a lot of the positions I've been in, I've been the first peer specialist in them. I think I've been blessed to be on the shoulders of the people in front of me that have, been the pioneers of this work. But I see the work that I've been doing is really taking those kind of pioneering steps and how do we take that to the next level and really codify that into our system.
It's hard to put into words the expressions of gratitude that people have shown. And what they're doing is telling us about their power, their resiliency, and their strength. And being able to bear witness to that amazing resiliency of the human spirit is amazing. We have people who knew for a fact the only thing they would ever be able to do is sit at home and take their medication, who've gone on to work for major industries. One bought a condo in Italy that when not using it, puts it up for other people to use. I mean, just amazing things. People traveling who never thought they would get to travel. And so it's just that's what this is about. And if we had a system that saw that as the expected outcome of treatment, what a different world we would live in.
So in these different ways, I think that the resounding thing that we heard back from folks is that we really need to invest as a state in building our peer and recovery organization. So that's going to be our peer-run organizations like consumer-operated service providers, like recovery community organizations. And so that's the mental health and substance use peer-run organizations. Invest in our mental health clubhouses, and then invest in the programs inside of our clinical organizations that are really devoted to developing these. But we really see the answer to some of the questions that folks have, like how do we create more of a career ladder? How do we create more accessible services across the state? We see investing in these community-based entities, especially our peer organizations, as being the answer to that.